Saltzer is a modern medical clinic. Dr. Saltzer started this clinic many years ago, and it's grown through the years at a steady pace. The facilities have been upgraded and expanded on a regular basis. Doctors have been added, and I'm sure today if Dr. Saltzer was to return and pay us a visit, he'd be most impressed with this clinic. I've been told that when Dr. Saltzer and some of the early physicians were getting together to organize Saltzer Medical Clinic, they hoped that they could develop a clinic that would be the Mayo Clinic of Idaho or the Northwest. I'm not sure that we've achieved quite that status, but Dr. Saltzer wanted to have the whole patient be cared for, and he wanted to care for patients from cradle to grave. And so Saltzer Medical Clinic has tried very hard to have enough primary care practitioners so that we can render the regular medical care to the patients, and also has tried very hard to bring in specialists so that when special needs arose in the care of the various patients, we had the specialists here to take care of those patients. We've also worked extremely hard in Saltzer to maintain quality, which I'm sure Dr. Saltzer always felt was most important in the medical care of patients. And I think we have one really shining example of that here at Saltzer. We have a state-of-the-art, full-service medical laboratory, and it does very quality work and continues to work hard to maintain that high standard. When I came to Saltzer in 1992, there were about 22 or 23 physicians here. Today, the clinic has grown to a number of 48, or soon will be 48 physicians who practice at multiple sites. There has been a recent addition also of occupational medicine, which has been a really big need here in the Treasure Valley. Also, we've added PAs and nurse practitioners. That was something that was not present in this clinic when I first started to practice here. We also have emergency care sites where patients who have immediate problems that aren't real serious can be taken care of on a very rapid basis and meet their needs that way. We have associated physical therapy with the group. We also have a state-of-the-art imaging facility. It can do almost all of the imaging that a practitioner needs, except for some of the very most technical and most expensive imaging procedures. I'm sure as time progresses, Saltzer will add those particular facilities to their imaging center so that almost all imaging needs can be met. Probably one of the most interesting things that's happened since I've been here is our change from paper records to the electronic medical record. About 8 years ago, Saltzer implemented the electronic medical record, and I suspect that we were, if not the first, one of the first clinics and maybe first practices to use the electronic medical record in Idaho, certainly. The other thing that's changed that probably is really different is that we have now a new specialty called hospitalists. That has allowed the physicians, the primary care physicians in Saltzer Medical Group to spend more time seeing patients and having more time with patients because they do not have the added responsibility of the hospital as well as their clinic responsibilities. The future of Saltzer Medical Group will be characterized by growth. We will continue to grow as we have through the years. There will probably be some kind of partnering or association with another group or a larger group or hospital, because in today's world there probably is no way that you can meet all the patient's needs without being partnered with some larger concern so that they can bring some of the procedures and images and those sorts of things to the patient. The other thing that we're going to see a big change in is there's going to be a lot more nurse practitioners and physician's assistants in the clinic. There's no way that primary care can meet the needs of the people without these added practitioners. These folks will be very important in monitoring certain chronic problems. They will do primary assessments on patients, and they will render certain levels of care and treatment to the patients in Saltzer Medical Group. Also, I think that we will see a much bigger emphasis and a bigger part of the clinic working toward preventive care. We will probably see both adult and child immunization clinics. We will see diabetic and dietitian and exercise clinics. There will probably be group meetings or group appointments where patients with the same kinds of problems will meet in large groups, and then maybe those people who have a single new problem will be broken out to see a practitioner. And lastly, I see a greater use of the computer. There's no question that doctors and patients will be able to communicate with each other more rapidly and more efficiently using the computer. I'm sure that we'll use telemedicine in a larger degree in the clinic so that we can communicate immediately with teaching institutions or larger facilities or bigger clinics or specialty clinics to have immediate consultation on patients who are presenting to us with very complicated and serious medical problems. And lastly, the technical world will rapidly change, and Saltzer Medical Group, I'm sure, will follow that change so that they can give better care, more efficient care to the patients that they serve.